Good afternoon, everyone. I'm conscious that I am the last person to speak, so I'll make it very quick. I am a researcher by training, incidentally, and I did do my research on road safety. I was trained to do road safety research. However, I don't have a research presentation. What I actually would like to talk to you about is the set of voluntary global performance targets for road safety performance targets for road safety risk factors and service delivery mechanisms that were recently supported by member states in November of 2017 through a formal consensus process. Just to give you a little bit of background about why these targets were actually established and why there was a need to come to this agreement. Essentially, I think Stephen actually mentioned this in the sense that, as you know, the SDGs in 2015 set forward a very ambitious aspirational target of a 50% reduction by the year 2020, which is only 2 years away. And part of the rationale for the establishment of these targets was, in fact, to provide an operational set of targets to help guide countries work towards these aspirational targets. The other part of it was to help address the fact that the SDG target 3.6 was coming to an end in 2020, and there needed to be some sort of extension, if you will, whether it happens through another resolution, to have another set of indicators that would go to 2030. So the mandate for this target actually came initially through the Brazilian meeting in the highlight of the ministerial summit in Brasilia in 2015, which called for a set of new targets. This was then reinforced through a UN General Assembly resolution as well as a WHA resolution in 2016. This then, which says it would request WHO in collaboration with other UN agencies to facilitate the transparent and sustainable process with all stakeholders to develop these voluntary performance targets. And again, the idea was that these targets were not meant to compete with the SDG target per se, but to complement them by providing a more operational guide for member states to use. And at the global level, it was also meant to help to continue to put the momentum and to generate a level of awareness for road safety, as well as to continue to raise awareness about the importance of monitoring progress towards both the Decade of Action and the SDG. And at the national level, what we hoped that this would achieve was to, again, keep focused action and to also allow more monitoring at the national level. So these are the criteria for the developing these targets. Again, these criteria were developed through a consultative process. I won't go through all of them, but again, one of the main things was that the targets should be based on evidence, and that they should be achievable, and that they could be measured, and that they were easy to communicate. This is the process. As I said, it was essentially a 2-year process. We actually, WHO developed 2 versions of papers, which were a 0 draft as well as a version 1 that was posted and where we received actually public comments. That was then revised, and then we had a second version which was again put forward, and then there were also a number of regional consultations that took place in between. In November, this is when the formal consultation took place. It was in Geneva in the WHO headquarters, and we had the participation of over 45 member states who came and deliberated over a 2-day process, and at the end of that 2-day process, they agreed upon a set of 12 global targets, which I will go through. At the conclusion of the meeting in November, member states also requested that WHO, again working with UN partners, to facilitate an informal process to identify some indicators that could be used to support these global targets. And that was actually just done a few weeks ago at the end of February. And so we had an informal consultation in February, and at that time, a set of 33 indicators were identified. And here we are, we're here now, and we're in the process of disseminating those targets. And actually, next month, there will be a resolution that will be tabled that will welcome these targets and encourage member states to adopt national targets as well. So before I go through these targets, I just wanted to say that this was done through a formal member state process, and even though technical agencies were present, it was member states that actually made the final decision, and the wording choices were also determined by member states. So we, as the Secretariat, didn't actually have control over the actual specific wording. The targets have been sort of grouped along the pillars that were used in the decade of action. And again, this was not to sort of reinforce silos, but as David had said earlier, it was really meant to suggest that, to draw attention to the fact that within the system that a number of issues needed to be addressed in order to achieve road safety. The first issues that were grouped here are about road safety management. The first target calls for member states to establish a comprehensive multi-sectoral plan with time-bound targets. And this actually was deliberate, that they actually called for that to be done by 2020, saying that that was the first step that would be needed in order for the rest of the targets to be achieved. So that as a first step, the target was set for 2020 to achieve, to actually develop and establish multi-sectoral plans. The second target was to really accede to 7 core UN road safety conventions. Even though there are a number of them, they had identified a set of core UN conventions that they felt that all countries should accede to. Pillar 2, the second grouping of targets relate to safe roads and mobility. And again, these are things that I think you probably all recognize in terms of ensuring that all new roads achieve technical standards. Both new and used roads, and you probably are wondering why one of them says a 3-star rating and the other doesn't. The one that speaks to existing roads doesn't refer to a 3-star rating, and again, that was a member state deliberation where they felt that for new roads it might be more feasible to apply those standards, but here they wanted to have a more liberal interpretation of ensuring that roads are safe, that take into account the safety of all road users. Target 5 is about the vehicle standards, and again, it calls for member states to accede to the conventions and actually adhere to the standards, or actually have in place standards for vehicles, and they sort of reference the UN and or national equivalents. That language was put in there because a lot of member states were concerned about the fact that we were referring only to UN standards, and they wanted to also recognize that some countries, such as the United States, have their own vehicle standards, and that should be acknowledged as well. Target pillar number 4, there are 6 of them, and they talk about they're aimed at safe road users. And the first one is looking at speeding, essentially. It's reducing the number of a reduction in speed-related injuries and fatalities. And the language here is a little bit complicated. It says to have the proportion of vehicles traveling over the posted speed limits and achieve a reduction in speed-related injuries and fatalities. Again, this was put forward as a target, and the idea behind this was not to be so prescriptive to tell countries exactly what to do, but to let them interpret and determine what is appropriate. One of the challenges, as you all know here, is attribution of fatalities and injuries to speed, and whether or not you can actually, most countries have the data to actually do that. I'm talking specifically about many low and middle income countries that don't actually have sort of the ability to make that to make that determination after the fact. 7 is trying to increase the proportion of motorcycle riders correctly using standard helmets to 100%. Number 8 is about the use of safety belts as well as child restraint systems. Target 9 aims to reduce injuries and fatalities related to drivers using alcohol and a reduction in those related to other psychoactive substances. This came up as a result of the discussion about the recognition that more and more drugs, marijuana is becoming legalized in a number of countries, but also opioids and abuse of prescription medicines could also cause impairment for drivers, and so that's why that language in terms of psychoactive substances was added. Target 10 is to prohibit, restrict or prohibit the use of mobile phones. And 11 was really aimed at addressing the problem of professional drivers who drive for an extended period of time and ensuring that there is legislation or regulations that actually limit the number of hours that professional drivers are on the road. And then pillar 5 is actually addressing post-crash response. And again, there was a lot of discussion about what this target should be, what would be the things that all countries could work on, and they came up with actually a very simple target, and that was really just to, there's no reference to golden hours or anything like that. It was merely to say that wherever countries stand currently in terms of their post-crash response, the idea is to reduce the time between the injury event, the crash, and the provision of professional care. And this means could mean in some instances where there is no emergency number, that they establish an emergency number. It means that training for bystanders, or it means implementing legislation around Good Samaritan laws to protect people who are responding. But anyways, it was just to really reduce that time interval, and that was the main thing that was targeted there. So that's really the end of it. As I said, in terms of the next steps, there will be a UN General Assembly discussion next month in New York. And then as a follow-up to this, it's really thinking about the development of resources and tools to assist the member states to implement. And I think implementation is really where the key challenge lies. I just want to use this opportunity to reflect a bit on the comments that were raised by the speaker before me in terms of saying that I think one of the challenges that we're grappling with is this idea that there are proven effective interventions and all we need to do is ensure that countries take them up. And I think it's a bit too simplistic, and I think what we're realizing is that it's not a matter of just saying, here, do this, and what we're going to be providing countries is not a set of instructions about how to implement helmet laws or how to enforce helmet laws, but rather I think is to really help countries address this issue about balancing the need between profitability, because those are real things. We care about efficiency, we care about sustainability, we care about profitability. And I think what we need to do is to shift the focus a bit and not talk about safety as an outcome, but as I said this morning, safety as a value. I think we need to put safety as a value right up there when we talk about efficiency, profitability, and sustainability. And I think until we do that, we're going to be continuing to talk in the same way that we've been talking for the last 10 years and saying, here we know what works, but we're struggling to implement. And so I think perhaps the time is to actually shift the dialogue a bit. And my last response to the previous speaker is that I would actually challenge the notion that innovation is costly or difficult to do in low-income settings. And I actually think that actually in most low-income settings, as Dinesh pointed out this morning, there's actually a lot more innovation that happens. People are quite creative with the resources that they do have. They are quite creative about how to make the most of things. And part of our challenge, I think, is not looking, perhaps starting to look for those types of innovations and looking to see, for example, how do you make the most of a setting where you have the safest vehicle or a safe journey being a tuk-tuk with an overcrowded set of kids, as opposed to only thinking about how do we transpose this idea or this image of safety that exists in high-income countries and transpose that exactly as it is in low-income settings. And I think that's where the challenge will lie. So I'll end it.
Okay, thank you.